Feeding a newborn can feel like trying to solve a Rubik's Cube while sleep deprived. Every day is different, every feeding is different, and sometimes nothing works the way you think it will. This presentation will walk you through practical strategies for newborn feeding, breastfeeding, pumping, and postpartum self care. We'll cover what to expect, tips for comfort and success, when to seek support, and how to build a routine that works for both you and your baby. The goal? Confidence, comfort, and connection, plus a few laughs along the way, because if you don't laugh, you might cry, and that's okay too. Let's talk about those first days with a newborn, because spoiler alert, no 2 days are the same, and no two feedings are the same either. Skin to skin isn't just a cute Instagram moment. It's a powerful way to bond, increase oxytocin, and help your baby feel safe and regulated. And it's not just right after birth. Think of it as a lifestyle during the fourth trimester. Snuggle, baby wear, and keep your infant close. Why? Because catching early feeding cues is much easier when you're tuned in. Crying? That's late. By the time your baby is screaming, you're basically troubleshooting a full-on hunger emergency. A fussy baby is harder to latch, so being proactive with closeness and observation makes everyone's life easier. Less stress, more milk, and fewer tears, at least for the parent. Sometimes, no matter what you try, your baby just won't latch, and that's okay. Take a deep breath. You're in control. If your baby is fussy, try holding them upright on your chest. Take several slow breaths. Talk or sing to them. Basically, become a walking lullaby. If needed, get a helper to soothe the baby while you regroup. Remember, a calm baby and a calm parent makes latching much easier. Also, don't be afraid to experiment with different breastfeeding positions. If you're uncomfortable, sore, or just plain tired, a new position can make a world of difference. Think of it like adjusting the antenna on an old TV. Sometimes a little tweak gets everything working perfectly. Babies love to sleep, so much that they sometimes forget their other job, eating. The good news? It's very hard to overfeed a breastfed baby. The trick is offering both breasts at each feeding. Even if your baby dozes off after one side, try burping, checking the diaper, or gently arousing them to offer the second side. It's okay if they refuse. Just always offer. Keep your baby close after feeds. They'll either drift into a deep sleep or start rooting around, showing you they need more. Either way, closeness is key. Breast compressions are your friend. Occasionally, gently squeeze the breast during a session to help milk flow. Keep your baby active and support a fuller feeding. If your baby chokes or gags, slow down. No need for heroics. If your breasts are too engorged for a comfortable latch, use a warm compress or hand express a little milk to soften the tissue. And finally, positioning matters. Keep your baby close with nothing in between. Cheeks and chin should always touch the breast. Never chin off the chest. Think of it as a little physical GPS guiding your baby to the milk. Let's be real. Mothering and the postpartum period is hard. Crying isn't just a challenge, it's a form of communication. It also releases oxytocin, which is good for your spirit. And yes, even your milk supply. So hug your baby, cuddle your partner or pets, and don't feel guilty about enjoying a hot cup of coffee or a piece of chocolate. These small acts help release oxytocin and strengthen connection, even during tough moments. Remember, breastfeeding is a learned skill for both parent and baby. It takes practice, patience, and sometimes a lot of trial and error. Importantly, breastfeeding should not hurt or cause physical trauma. If it does, reach out to a lactation consultant or healthcare provider. Don't just grate your teeth and hope it gets better. Finally, set yourself up for comfort. Use pillows, blankets, or towels so you aren't straining while holding your baby. Your comfort isn't a luxury. It directly affects the quality and sustainability of your nursing sessions. Think of it as investing in ergonomics for your new full-time job, Parent Edition. Let's talk about pumping. Think of it as a tool in your breastfeeding toolkit, especially helpful if your baby is struggling to latch. If you or your baby are having trouble with nursing, or if nipple or breast pain is making it hard to feed, pumping can protect your milk supply. allow bottle feeds as needed, and give you time to work with a lactation professional to get back on track with your goals. And here's the really important part. There's no single right way to do this. Some people never use a pump. Some use it exclusively. Some fall somewhere in between. All of these are okay. The best approach is the one that works for you and your baby. Pumping is a helpful tool, but it should never hurt or cause physical trauma. Start with a low suction setting and gradually increase until you find what's comfortable for you. And just so you know, cranking it all the way to maximum won't magically boost your milk supply. Your breasts aren't a slot machine. A simple tip. Before pumping, try a small amount of organic coconut oil on your nipples. This can reduce friction and make the experience much more comfortable. Think of it as a little pampering for your hard-working body while you're feeding your baby. Flange size matters a lot. Using a flange that's too big or too small can cause discomfort, even tissue trauma, and can negatively affect milk supply. Think of it like wearing shoes that don't fit, painful and counterproductive. If pumping is part of your plan, invest in a good pumping bra. It's basically hands-free multitasking magic. Not all pumps are created equal either. Wearable pumps are convenient for moms on the go, but they don't empty the breast as efficiently as a standard pump. Standard or hospital-grade pumps are usually best for exclusive pumpers or parents struggling with low milk supply. Flange sizing often requires a little trial and error. Try different sizes to see what works best, and don't hesitate to reach out to a lactation consultant if you're unsure. The right fit can make pumping more comfortable, more efficient, and a lot less stressful. There are so many lactation products on the market. It can feel like walking into a candy store, but with way more rules. Not all products are necessary, and not all are created equal. Some of my personal favorites: a cute baby. I like that one quite a lot. A breast friend pillow, a full water bottle for mom, a cozy receiving blanket, some organic coconut oil, and a solid support team. A quick note on nipple shields. They are not a fix-all. Used incorrectly, they can actually make feeding more difficult, so don't treat them like a magic wand. If you're unsure which products will help you and your baby the most, reach out to your healthcare provider or lactation consultant. They can guide you with your goals in mind and save you a lot of time, money, and headaches, plus a little sanity. Here's the bottom line. Feed your baby on demand. Offer both breasts at each feeding. Nourish your body with whole foods. Drink to thirst and rest whenever you can. Which, let's be honest, maybe whenever you get a single quiet minute. Take the help when it's offered. Reach out to your lactation consultant or healthcare provider as needed. Trust your instincts, and most importantly, enjoy your sweet baby. You're doing the best you can, and sometimes that's exactly what matters. Remember, there's no perfect parent, just loving ones who are trying, and coffee and chocolate are totally acceptable survival tools along the way. Feeding a newborn is a journey, sometimes predictable, often unpredictable, and always full of surprises. You've learned strategies for breastfeeding, pumping, positioning, and postpartum self-care, but the most important tool in your toolkit is you, your intuition, your patience, and your persistence. Every baby is unique, and every parent has their own rhythm. What matters most is noticing cues, being flexible, seeking support when needed, and celebrating small victories, because they add up to big progress. Remember, this isn't about perfection. It's about connection, confidence, and doing your best in the moment. You've got this, and your baby is very lucky to have you.